Welcome back. What if I told you that the future of healthcare is less about developing new medications and actually getting us to need fewer prescriptions? And what if we had national healthcare leaders who were willing to ask the tough questions, who were willing to not only challenge how we treat disease, but look into why are we getting sicker in the first place? I'm pretty excited. Two big pieces of news. Number one, Dr. Bhattacharya, a Stanford physician and PhD in economics, is our new head of the National Institutes of Health. Recently, Casey Means, again, a Stanford-educated physician, has been nominated to be our next Surgeon General. As a 30-year physician executive, I'll explain to you why this could represent the most radical shift in healthcare leadership in decades. Again, my name is Dr. Joe Corcoran, and I have delivered thousands of babies as a practicing OBGYN, but I've also been chief medical officer for hospitals from Florida to California. And in that CMO role, my primary responsibility was quality of outcomes and patient safety. So I'm hoping that we can walk together as we go through this disruptive era in our healthcare leadership and maybe, just maybe, come out with a healthier, safer system for patients like you and me. So our institutions, our hospitals, insurance, pharma, has been prioritizing managing illness over preventing illness and promoting health. These two figures are the newest members of Bobby Jr.'s team that's questioning everything. They're challenging the orthodoxy of what I learned more than 30 years ago. Seems reasonable. Things change. And our knowledge base grows. So as we go forward, my ideal and my hope is that these leaders, as they shift us more toward eliminating disease, not treating the symptoms, as they lead us toward prevention, not disease management, as they lead us toward understanding the root cause of what is causing us to get sicker, that empowers patients like you and me. And that's super exciting. So Dr. Bhattacharya, very smart guy, very, very smart guy. Stanford undergrad, Stanford med school, PhD in economics after med school. Now, he has spent most of his life in more the administrative medicine world. And he is now in charge of the National Institutes of Health. He's also probably going to have to give up his day job, which is being a professor at both the Stanford Med School and Stanford Business School. But given the opportunity that he's being presented, I think that's a pretty good trade-off. So he kind of hit the radar in 2020. Not everybody agreed with him, but he, again, was willing to step forward when very few were willing to challenge the conventional wisdom. And as early as March of 2020, he wrote an op-ed that was widely read that really challenged whether we needed to be locking everybody down, from our seniors who were very vulnerable to our teenagers who weren't, or did we need to move to a focused strategy? A couple months later, he was one of three authors of what was known as the Great Barrington Declaration, and that presented a lot of data that got poo-pooed because it wasn't what most people were saying. But now that that paper is almost 5 years old, they weren't right about everything, but maybe they weren't as wrong as the critics said 5 years ago. But it was this whole focus on focused protection, not locking everybody down. Listen, teenagers, kids, young adults who were healthy and going to the gym and eating right, they were at very little risk. Those weren't the patients, by and large, who died because of COVID exposure. The ones who died were mostly, and there were always exceptions, and my heart goes out to those families who lost healthy loved ones. But the majority of patients who died during COVID had pre-existing conditions, had comorbidities. They were sick. They were old. They were infirmed. He and his other researchers questioned that out loud. And again, may not have been right about everything, but wasn't wrong about a lot of stuff either. Now at NIH, he has an opportunity to really focus on metabolic disorders. Again, I've talked about obesity, I've talked about diabetes, pre-diabetes. All of these have exploded in my lifetime. He's going to be focusing on it. He's going to be focusing on chronic conditions. He's going to be looking at the root causes rather than novel treatments. First and foremost, Dr. Bhattacharya has prioritized regaining the trust of us, restoring the credibility and the believability. And he's going to do that through greater transparency. So I'm super excited to have Dr. Bhattacharya in that role. Again, may not agree with everything he says or suggests, but God bless him. He's going to be asking a lot of the tough questions out loud, and I applaud that. The interesting nominee was just very recently, Casey Means, MD, Stanford-educated physician, completed 5 of 6 years of her Stanford ear, nose, and throat, head and neck surgery residency training, walked away after she, by her own description, had a revelation that she was not making patients well. She was treating their diseases, and she felt compelled to do more. Dr. Means and her brother, Callie Means, who is also an MBA from Stanford and a former lobbyist, in recovery, as he likes to say, have been all over the place. They've been on Joe Rogan. They've been on, everybody. Casey Means recently wrote a book called Good Energy. And I would encourage you to pick up a copy. I'll put a link in the show notes. Good Energy and Dr. Means really are talking about getting back to living a healthier lifestyle. I will tell you, I'm a simple-minded guy, and my simple approach to living a healthier lifestyle, and I can do better, really comes down to 3 things. Number 1, you've got to eat clean. What does clean eating mean? It means eating food that started its life cycle as food. It came out of the ground as food. It didn't come out of a chemistry lab as food. The second thing is move. Whether it's 10,000 steps or a bike ride or just getting up and walking around while you're on a Zoom call, you've got to maintain mobility for a lot of reasons, not just joint health, but for a lot of reasons. We've got to eat clean and we've got to move throughout the day. The third thing that is vastly overlooked and highly emphasized by people like Casey Means is you've got to get sleep. Sleep is when the body restores itself, and most of us don't get enough of it. And I'm guilty of that too. What's really neat is that she's bringing more of a prevention-centered focus to public health. It's kind of cool. The whole topic of functional medicine feels a little odd because it's not traditional Western medicine. But, if we incorporate the best parts of it and overall it improves the outcomes, hey, let's give it a shot. What I think is really interesting about Casey Means being nominated to be the Surgeon General is within hours. The social media universe, particularly on X, and, exploded with criticisms about her. And they're saying she's not a real doctor. She doesn't have a medical license. She didn't finish her residency. I mean, a million things that they're talking about. What's really, really intriguing to me is that she is getting pummeled from the left and pummeled from the right. What does that tell you? I don't know. Too early to tell. But I was really surprised at the blowback, because personally, I like that outsider voice being brought into the conversation, and she's not afraid to talk out loud. Together, Dr. Bhattacharya, Dr. Means are really going to be focusing more on root causes rather than reactive or symptomatic care, right? Beyond the cough, what caused us to get the cough, right? When you treat the cause, you can eliminate the disease. If you're just treating the symptoms, you can just eliminate the symptoms. I like that. They are going to favor inquiry over orthodoxy. They will ask the hard questions. They will challenge you. Think back to when you were in school. Your hardest teachers challenged you. But maybe not in the moment, but 2-3 years later, weren't those also the teachers that you considered your best teachers? And they're going to make us uncomfortable with the questions that they ask. But again, we are spending so much money on healthcare and getting such meh results. We need to question what we're doing. Einstein is frequently credited with the quote about the definition of insanity is doing the same thing over and expecting a different result. We can't keep doing the same things. We have to do things differently. It's disruptive and it's uncomfortable, but it's necessary. What's really exciting is, in general, together their shift is going to be around health and wellness being more important than disease management. And that's exciting to me. So this is more than just a leadership change. It's a leadership change, plus it's potentially a massive shift in culture. And again, that's disruptive, and disruptive is messy, and messy is uncomfortable, but I hope you'll give them a chance. I hope that you'll be willing to be uncomfortable and to consider, am I better off treating my symptoms, or am I better off addressing the reason I need this medication in the first place? Folks, I'm telling you, this is an exciting, scary, disruptive, but exciting era to be walking into in healthcare. I'll say it again. This is the first time in my lifetime, in my adulthood, where we're being allowed to really expect big change. We have to do better than we have been doing. No questions asked. I'm hoping that you will walk this walk with me. Let me be your chief medical officer. Let me help you understand the clinical side and the business side. If you are willing to take that walk with me, please hit the like button, hit the subscribe button so that we can keep the conversation going. And I want you to become an advocate for yourself and for your family and for your loved ones so that we can get to a better, healthier place, and we can live longer, happier, more productive lives and enjoy our families and enjoy what really makes us happy. I want us to be happy and healthy because we've got to take care of ourselves before we can take care of others. I'll see you again soon.